pericardial sac. That is the outer membrane that surrounds the heart. The epicardium, or the visceral pericardium, would be the inner membrane that surrounds the heart. So you have the epicardium right on top of the heart, and the pericardium, or the parietal pericardium, or pericardial sac, just outside of it. So pericardial sac, epicardium. Myocardium is the muscular layer. And then endocardium would be lining the chambers on the inside, the membrane lining the chambers. The apex is the pointy part. The base is the top. The atrial appendages are these right here. So like the corners of the atrium on the inside. There. The ventricles would be the two big chambers at the bottom. The right heart and the left heart. And remember, I won't ask those as a question, but just so you're aware, right side, left side. Interatrial septum, the wall between the two atria. So this is an atrium, this is an atrium. The wall between the two is the interatrial septum. The tricuspid valve, this on the right, between the right atrium and the right ventricle. That's the tricuspid valve. The bicuspid valve is this one, between the left atrium and the left ventricle. The aortic semilunar valve is at the base of this, which is the aorta. So if you open this, get that out of the way, all that, it's this right here. So this one in the back, the aortic semilunar valve, is that one. Some of these you have to really get in there. Can you guys see back there? Okay, pulmonary semilunar valve is right in front of it. This one. Okay, chordae tendineae, the strings coming off of the tricuspid valve and the bicuspid valve. Papillary muscles, big white things in the ventricles. The trabeculae carnae, just all the ridges in the wall of the ventricle. The pectinate muscles, wall of the right atrium, this white ridge along the top here. And then the fossa ovalis, that I don't think you're going to be able to get in your video, but it's in the interatrial septum. It's that circle. It's number 81 in there, which my finger's in the way now, but there it is deep inside of there. Okay, now the ligamentum arteriosum. We didn't do that up there because it's really hard to see. It's this little piece right here. That's the ligamentum arteriosum. That little tiny piece. I don't like it on this model because it's hard to point to. I like it better on this one because it has a little bit of a color to it. It's that light gray. So I would use this model for the ligamentum arteriosum. The ligamentum arteriosum.
I just like am thinking like, okay, I'm taking an online class and then this class. So like, what's the that my summer like is actually starting? Like my online class, I can just do like
Okay, for the conduction system, we're talking about electrical activity in the heart. We're going to be using this model, take it apart, see all the yellow stuff inside. That's what we're talking about here. The sinoatrial node, which is the first one right here. It's this.
That's what I did for my exams, like.
It's the yellow dot at the top of the right atrium. So way up here.
I literally like drove home on Friday to Montgomery County.
The atrioventricular node, which is the second one. North Carolina, that yellow dot at the bottom of the right sham.
I think this is like you to go out to July 4th, and then my boyfriend met.
That one's which one?
The atrioventricular
North
node.
Carolina, it was just Indiana, just off. You're just like, done.
Okay, the AV bundle
I'd rather
is
take a
this
summer
yellow
class
line.
now than have to like have my summer and then come back.
It's going horizontal.
Like beginning of July, you know?
So it would be like a month
Oh
off.
yeah, that's what I'm saying. Some people are like,
The AV
like
bundle.
summer session was like that really fun.
The bundle branches are
Like
these
it's
two that go straight down through the
like
interventricular
I'm like a
septum.
10-day break and my brain is like still like adjusting. So my hands are like.
And then the Purkinje fibers, sure, that one. Are all these little guys at the ends. So all the way out here. Okay. So work on those